Today I'm going to be talking about the 5 best strengthening exercises you can do before knee replacement surgery. Make sure to watch until the end of this video because I'm going to include some bonus tips that you don't want to miss if you're scheduled for knee replacement surgery. I'm Dr. Wong with Next Level Physiotherapy, and this channel is dedicated to helping people just like you get out of pain without relying on medications, injections, or unnecessary surgeries so you can remain as active, healthy, and independent for as long as possible. If you find these videos helpful, please consider subscribing so you don't miss out on our weekly videos. One of the most important factors I look at before knee replacement surgery is a patient's strength. Ideally, you would want to start a program 6 to 8 weeks before your knee replacement surgery so that you can come out of surgery stronger, faster, and with less complications. The first exercise is the short arch quad, and this is to address quad strength. Essentially, you want to take a yoga mat or a towel and roll it up and put it under the knee that's getting surgery. So let's say my right knee is the one that's scheduled for knee replacement surgery. And what you want to do is you're going to point the toes up towards the ceiling and then press the back of your knee into the mat or the towel until the heel comes off the floor or the bed, whatever surface you're doing this on. And what you're gonna feel is a strong contraction of thigh muscles. You might also feel a stretch in the back of your knees, okay? Hold this position for 3 seconds and then come down nice and easy. Once again, you're gonna prop the toes up towards the ceiling, press the back of your knees into the mat until you feel a tightness in the thigh muscle. Hold for 3 seconds, then come down slowly. Ideally, you wanna start this 30 times a day and eventually progress to 60 times a day. The second exercise is a straight leg raise. This is another exercise to strengthen the hips and the knees. So what you do is you start off by lying on your back, and then you're gonna bend the knee that doesn't require surgery, which is my left. And for your right leg here, you're gonna bring the toes up towards the ceiling, feel the thigh muscles tighten up, and then you're gonna lift off until a certain point. If your knees bother you, you're gonna back off a little bit, hold that sweet spot position for 3 seconds, then come down slowly. Once again, prop the toes up towards the ceiling, feel the thigh muscles engage, lift off just before the point of pain, 3-second hold, come down slowly. Ideally, you want to do this 30 times a day to start and progress to 3 rounds of 30 times a day. The third exercise is the sideline straight leg raise. This is to target a muscle called glute medius, which is a hip stabilizer muscle. And what it helps you with is standing and walking. You're gonna lie on your side. Once again, my right leg is the one requiring surgery. You're gonna have the bottom knee bent, top leg is straight. And then from here, the foot is relaxed and you're gonna lift off until you feel behind the pant line. So some pants have a line that goes directly into the foot. So it's not the muscle in front of the line, it's a muscle that's right in back of the line. So once you feel that muscle and you don't feel anything else, meaning you don't feel the inner thigh, you don't feel your butt cheek muscle, you don't feel your low back, you hit that sweet spot. And once you hit that sweet spot, you wanna hold that for 5 seconds. And then you're gonna relax slowly. Now, because this is an endurance muscle, you wanna eventually build up how long you're able to hold up that leg. So ideally, you wanna work up to 60 seconds straight. Now, as you lift off, as you feel that muscle behind the line of the pant leg, what you're gonna feel is a burning sensation as those muscles fatigue. That is a normal sensation. But what you should not feel is these muscles kicking in, or the front muscles kicking in, or the butt cheek or the hamstring muscles kicking in, because if you do, that means this muscle right here is no longer working as much as it should, and these muscles here are compensating, and you have to take a breather. The fourth exercise is a glute activation technique called butt squeezes. You might be wondering why we are working a butt when it's a knee that hurts. Well, your muscles work together as a team, and oftentimes the knee is overworking because other muscles, like your butt, just aren't working efficiently. So 80% of the people we see in a clinic who require knee replacement surgery have a really hard time activating their butt muscles. So this is how you do the butt squeeze. You want to lie on your stomach and open the knees up. And then the next step is you can prop your elbows under your chest if you want to, or you can have your chest completely flat on the table or the floor. So what you're gonna do is you're going to bend the knees, press the heels together, and then from here, as you press the heels together, you're gonna pinch your butt cheeks together. okay? So I want you to squeeze the butt cheeks as hard as you can and then relax. Now you should not feel your low back or your hamstrings here, because if you do, that means you're arching too high up, therefore engaging your low back, so you want to drop your chest down a little bit. And if you're feeling your hamstrings as well, that means you're probably squeezing the butt cheek a little too hard. So press the heel in, squeeze the butt cheek where you don't feel a low back and you don't feel the back of your hamstrings. So ideally you want to hold that for 15 seconds, do 4 rounds to start. And once you get good at it, you want to hold for up to 1 minute at a time. Another way to pinch your butt cheeks and get the glute activation is lying on your back. What you're going to do is you're going to rotate both legs out, and then from here you're going to squeeze the butt cheeks so you feel the butt cheeks in the front. You should not feel the thigh contract really tight. If you do, that means you're compensating. So relax the butt cheek a little bit where this doesn't become super rigid and you feel primarily the butt cheek activation. Hold for 15 seconds, 4 rounds, and work up to 5 minutes at a time. The 5th exercise that you want to do before knee replacement surgery is called Glute Bridge, and it builds upon the last exercise that we talked about. So you start off with being on your back with both knees bent. This is called a hook line position. And what you want to do is you want to bring your heels as close to your butt as possible. Now if you can't do that because your knee really bothers you, you can come out a little bit, but the closer you are, the better, because you take the hamstrings, which is the muscles in the back of your thigh, out of the equation. Also, what you want to do is you want to open your knees up a little wider, and then what you're going to do is you're going to squeeze the butt cheeks and then push the middle of the foot into the table or the floor to lift the pelvis up. You should feel a slight stretch in the front of the hips. You feel the butt contract, and you should not feel your low back whatsoever. If you feel your low back, that means you're too high up. Drop down slightly where you still feel a stretch, still feel a butt cheek squeeze. Hold that sweet spot for 5 seconds, and then come down nice and easy. Once again, squeeze the butt cheeks, press the midfoot into the floor or the bed, lift up as you breathe out, feel a slight stretch in the hips, no low back arching, 5-second holds, come down slowly. So ideally you want to perform this exercise 30 times throughout the course of a day to start, and once you get stronger, you want to do 60 times throughout the course of your day. So a quick recap, the first 2 exercises are short arc quad and straight leg raise, which engages the hip and knee muscles. The sideline straight leg raise is a 3rd exercise, and that's for the hips, which will offset pressure off the knee. The 4th one we talked about is the glute activation butt squeezes, which help activate the butt muscles. And the last one we did so far is the glute bridge, which also works the butt muscles to help you stand and walk for longer periods of time. I know some of you guys might feel overwhelmed right now because this might be new information. We all are at a different level, and the main thing is just to get started. Start with what you can do and progress every single day. And what you'll find over the next few weeks is you're able to move a little better and the pain might actually decrease. Now I'm going to go over some bonus tips for you if you're going for knee replacement surgery. The first one, believe it or not, is drink more water. The cartilage in your knees is mostly water, so if you're dehydrated, you actually will allow the joint to become more stiff and achy every single time you try to walk or stand. The recommended amount of water that you should drink every day is 1/2 ounce to 1 ounce for each pound that you weigh. You're probably thinking, well, if I drink all that water, I'm gonna have to use the restroom all day. And yes, it may be inconvenient, but guess what? The fact that you are having to go use the restroom every few hours because you're drinking more fluids, you're getting up off your butt, using your butt muscles, you're probably moving the knees more, which will make it less stiff and achy. And overall, when you move more and your muscles get stronger, that's gonna best prepare you for knee surgery. The next bonus tip is about a muscle that most people don't think about when going for knee replacement surgery. And these are your calf muscles. Anytime you walk or step up a curb or have to walk up a ramp, you have to have adequate calf strength to perform those motions adequately. One of the best ways that you can improve your calf strength is a seated calf raise. This is a great exercise for those of you who can't tolerate standing for long periods of time. So the calf muscles is located behind the knee and comes straight down to the back of the heel. So when you sit in a chair, you ideally want the hip to the knee as a straight line and from the knee to the back of your heel as a straight line. And what you're gonna do is you're gonna lift the heels up and put the pressure on the ball of foot. Hold for 3 seconds. while you feel these muscles on both sides, then come down slowly. You want to perform this 20 times a day. Now for those of you who doesn't find this challenging, what you can do is put extra load or weight on top of the knees, do the same thing, hold for 3, come down nice and easy 20 times. And then for those of you who are really ambitious, put a heavier weight. In my case, I got a 15-pound, but I would just say go as tolerated. Lift up, 3 seconds, come down nice and easy. If you have any questions about these exercises, comment below and my team will get back to you as soon as possible. If you find these videos helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you on the other side.